Yeah, I'm Rich Chen. I'm Chief Medical Officer and EVP of R&D at Personalis. So the other oral podium presentation we have here at ASCO is also very exciting. It's in the area of immunotherapy monitoring. So just a little background is immunotherapy is one of the pillars of cancer treatment today. Incredibly exciting, technology where you can harness your own immune system to fight the cancer. Hundreds of thousands of patients receive immunotherapy a year. 40% of the patients are eligible of all cancer patients are eligible for immunotherapy, but only 12% of them actually respond. And so one of the most important things here is having a technology like NeXT Personal to be able to track the response of these patients and really understand right away if they are benefiting from the therapy or not.
Hi, I'm Chris Hall. I'm President and CEO of Personalis. And I think there's a couple of really exciting benefits to ultrasensitive testing. First of all is we believe it allows us to see cancer and recurrence sooner. And at the end of the day, a lot of patients are monitoring cancer progression over time with an MRD test to be able to see cancer at the earliest possible time. And we think the ultrasensitivity power of NeXT Personal allows the recurrence to be seen and ultimately to be acted on, which we're super excited about.
And so we have a collaboration here at ASCO that's being presented here at ASCO with the Vall de Hebron, Dr. Rodrigo Toledo, an expert in this field of cancer biomarkers. And he presented data that showed that using the NeXT Personal test, they can actually identify those patients that are responding to immunotherapy early in the treatment cycle. With this study, we looked at patients from over 18 different cancer subtypes, and that includes colorectal patients, lung cancer patients, breast cancer patients, bladder cancer, and the list kind of goes on. So this is really a fantastic study in its breadth. And then we looked at to see how NeXT Personal performed using an ultrasensitive test to monitor the response of those patients to immunotherapy. And what we found is that with NeXT Personal, we could predict which patients were going to respond much better to immunotherapy compared to the ones that aren't. And we can make that determination very early in the patient's course by using a NeXT Personal test. Because what we can see is patients that are responding to immunotherapy, the levels of the traces of circulating tumor DNA in the blood decrease on our test. You can see a decrease on our test with serial monitoring. So those patients that where the ctDNA levels are decreasing between the baseline levels and then by cycle 3 of immunotherapy, those patients have a clinical course that's much better than those that are not responding to the treatment. The patients that actually are responding according to the NeXT Personal test, those patients we showed live almost twice as long as the patients that are not responding.
The other promise is the potential of the power of a negative result. And we're starting to see in some of the data that patients that test ctDNA negative are unlikely to recur, and in fact have long-term survival rates that are almost 100% in some of the data set. And that can point to a direction to possibly do less therapy and do less invasive procedures for some of those patients, ultimately lowering healthcare costs and lowering toxicity for patients. And so we think those combinations ultimately are important to make MRD testing become standard of care for cancer patients around the country.